Hello, Anthony Chadwick from the Webinar Vet, welcoming you to our final session of the 36th World Veterinary Association Congress. We're going to be talking about COVID-19 today. Obviously, we live in very uncertain and unprecedented times, but we're so fortunate today to have a fabulous panel together for a question and answer on different aspects of the coronavirus. We have Professor Michael Baker from the University of Otago. Professor Michael is a public health physician, but he is going to introduce himself. So I'm going to just very briefly introduce you to each person, and then they're going to spend a little bit of time introducing themselves as well. We've also got Dr. Daniela dos Santos from the British Veterinary Association. She is the president this year. Professor Nigel French, who is the chief scientist for the New Zealand Food Safety Science and Research Centre. And then we've also got Dr. Grant McCulloch, who is the president of NZVA this year. And then we also have Dr. Scott Newman, who is working for the FAO Africa Regional Initiative. Dr. Matthew Stone is at the OIE. And then finally, Professor Scott Weiss is professor at the University of Guelph and is a diplomat of the American College of Veterinary Internal Medicine. So I'm going to pass it over first to Michael just to do a very quick introduction of himself. Over to you, Michael.
Yeah, kia ora. It's great to be here with all of you in these unusual times. Like many of us, I've been astounded by this event, something that shouldn't have happened but has, and now we're all collectively managing it. In New Zealand, I've been working on emerging diseases for over 20 years, and I work with Nigel French as part of One Health Aotearoa, and also with a research group at the University of Otago in Wellington. And I've been on the government's technical advisory group for the response, which formed late in January, and it's been a very intense process, I think, for all of us. Thank you.
And then over to Daniela.
Everyone. Great to be here. It's a shame that it's not in person. My name's Daniela and I am president of the British Veterinary Association, and I am here to talk about the impact it has had on the veterinary profession in the UK and how the profession has really come together and adapted in these difficult times.
And then over to Professor Nigel French.
Kia ora, good morning everyone. Nigel French, so I'm Professor of Food Safety and Veterinary Public Health at Massey University and co-director of One Health Aotearoa, as Michael mentioned earlier. I have been involved with providing advice, as Michael has, to the Ministry of Health, particularly on epidemiology through a technical advisory group. So it's been a very interesting time that we've had over the last few weeks and months. Thank you.
And then over to Dr. Grant McCulloch, who is the president of the New Zealand Veterinary Association this year.
Yeah, thanks, Anthony. Yeah, as well as being president, I still am a clinically practicing veterinarian. I own a group of predominantly small animal practices in Auckland and New Zealand, and we've certainly had challenges still functioning initially as essential services and now slowly getting back to normal. So thank you.
That's great. Thank you so much, Grant. And then over to Dr. Scott Newman. I don't know if you just need to unmute yourself, Scott.
Good morning, everybody. My name is Scott Newman. I'm the Senior Animal Health and Production Officer for the Food and Agriculture Organization of the United Nations. I'm based at our regional office, which is in Ghana in West Africa. And I've been working on One Health related matters and infectious diseases for 25, 30 years myself, and have had the good opportunity to work both in Africa as well as Asia and Europe. Thank you.
Thank you so much, Scott. And then over to Matthew Stone, who is at OIE.
Kia ora, everyone. World Organization for Animal Health, OIE, we've been playing a support agency role to the World Health Organization's lead on the issues in this COVID-19 response that relate to the animal-human ecosystem interface. So our typical modus operandi of pulling expert groups together and formation of guidelines in support of various aspects such as the WHO R&D blueprint, how to bring veterinary laboratories on stream to support public health diagnostic capacity, issues related to safe trade in animals and animal products, and surveillance guidelines on animals and case definitions, as well as disseminating information on animal events through our World Animal Health Information System.
That's fantastic, Matthew. And then finally over to Professor Scott Weiss from Canada.
Great. Thanks for having me. So I'm a veterinary internist that just focuses on infectious diseases and infection control. I'm also director for the University Center for Public Health and Zoonoses. I've been largely full-time on COVID since not long after it emerged, doing a lot of work on education to the public, healthcare providers, veterinarians, a lot of clinic-level guidance, working through continuing veterinary medicine in the COVID era. We also have active surveillance, so we do testing of animals that have been exposed to infected people and some pending serological testing. And work a lot on outreach for the general public and others. And we have a website called Worms and Germs blog that has a lot of our outreach activities.
That's fantastic, everybody. And I think I'd just like to make the comment that everybody is looking beautifully presented, considering there haven't been any barbers or hairdressers open for the last 2 or 3 months. So well done, everybody, on that. So we're going to start with our first question. We have got a few questions, so we need to move through fairly quickly, but we've certainly got a bit of time on each question. Perhaps first question I'd like to present to Michael. Where did COVID-19 come from, and is it a zoonosis?
Yes, well, I think it clearly is a zoonotic disease in terms of its source, but I would actually probably defer to some of my colleagues who I know have looked at this area more than I have.
So, Nigel, do you want to have first crack at that one?
Yeah, sure. So, I think the answer to the first question is that, well, we may never know, but certainly studies of the epidemiology, virus ecology and evolution are suggesting that it is a spillover from a wildlife population, wildlife reservoir, likely with some intermediate hosts, possibly some early cryptic spread in people, before then taking off as a major pandemic. It's very similar to other coronaviruses that also behave in a very similar way. The evidence from the virus ecology and evolution suggests that it's most likely bats are the origin, so horseshoe bats, very similar to viruses found in horseshoe bats in Yunnan in 2013. And also some sections are very similar to viruses found in the Malayan pangolin, which is you can see on the picture. So yeah. I think the evidence is a perfect storm, spillover, intermediate host, very dense population in Wuhan, travel hub at a time when a lot of people were traveling. So that's likely to be the scenario. So yes, definitely a zoonosis.
Fantastic. Does anybody else want to add any comments to that?
Go ahead.
Yeah, Scott, that'd be great.
Yes, the Canadian Scott here. I think one of the things that's important to point out, well, not important to point out, it's just a talking point is, this is the third major coronavirus jump into the human population. So it's one of these that's, a surprising event, but a completely unsurprising event. I think those of us in emerging diseases, maybe we're surprised at the scope of this, but I think we're completely unsurprised that something like this has happened. And this is something we've been talking about for a long time. And this is the whole One Health concern, that this has occurred, and it's not the last one. What we're doing now is also hopefully preparing us for the next COVID-19, which will jump sometime between tomorrow and the next 100 years. We have no idea.
That's really helpful. We'll say Professor Scott, just to avoid confusion. So how important are animals in the current pandemic, and how can we mitigate against this risk? I mean, Prof. Scott, again, do you want to lead off on that one?
Sure, I guess I can jump in. And the easy answer is we don't know, right? This is a human disease. The question, I guess, is it purely human-to-human transmission, or is it predominantly human-to-human transmission? And it's important to sort those out, because a small component of a massive problem is still something worth addressing. And that's what we need to sort out. We certainly know animals can be infected, so human-to-animal infection occurs. does animal-to-animal infection occur in the field situation outside of experimental situations? We know it can happen. And importantly, does that pose an epidemiologic risk? So can we get transmission from a person to an animal, then back to a person or to another animal? And it raises a whole range of concerns, right? And they're probably relatively low risk overall. But what we don't want to see is this moving into animals and then infecting people. What we don't want to see is this moving into animals and then infecting wildlife reservoirs or community cats or things where we can take it beyond the human scope. And I think my goal as someone who works with this on the animal side is to keep this as a purely human problem. So we don't have to think about an animal situation because we don't expose or we don't get it spreading in an uncontained manner in animals.
And then also, perhaps if Dr. Scott wants to speak about that as well. Just unmute.
Yes, I concur with Professor Scott on his approach in thinking about it. I think to date we really have no evidence to suggest that animals have transmitted any of this virus to people, but we're seeing the other direction. We're seeing people transmitting it potentially to animals. And obviously there are a range of different animals, whether it's domestic cats or big cats, tigers, lions, ferrets, mink, who all seem to be susceptible to the virus and have some clinical signs. Other animals, such as dogs, have tested positive, but we don't really think that they're showing clinical signs. So I think that there's concern in the fact that we know it's transmitting between the sectors, and just by definition, we would expect zoonotic diseases to be able to make these species jumps. But so far, it doesn't look like it's coming back to people. All the human cases have been linked to other human case exposure. I think the other point I just wanted to mention relates to mitigation measures. And I think one of the important issues that we're trying to approach, FAO as well as working with our joint IAEA division, are really supporting a lot of improved diagnostics to try to address the lab side of testing and dealing with testing in animals. And I think that, in addition to providing diagnostic kits, supporting lab reagents, PPE, and sampling materials, there's also some additional training for detection of SARS-CoV that's taking place and will be taking place through the Vet Disease Diagnostic Lab Network. Finally, I'll just, one last point is that, I think this is really an interesting example because particularly in Africa, we're noting, and I know it's happening in some other countries as well, the medical labs are being overwhelmed with diagnostic capacity. They can't keep up with the number of tests. And so we've been supporting some of the veterinary labs to actually help out, sort of taking a One Health approach and really chipping in to help address this public health issue as in a One Health spirit. So thanks.
Can I jump in there just for a quick point,
yeah,
Anthony,
sure.
if I get a minute? One of the questions that comes up is, well, why don't we know if animals play a role? And I think people have to realize how exceedingly difficult it's going to be to figure out if domestic animals play a role in this, because this is being spread so rampantly in the human population. Teasing out an animal component will be difficult because knowing you've been exposed only to an animal and not to a potentially infected person is going to be exceptionally difficult. And the reason I bring this up is where this is potentially, where are we going to find the easiest way to identify an animal to human transmission? In a veterinarian, or maybe in a shelter, or maybe in a groomer. It's going to be situations where we take an animal from a high-risk situation to a low-risk situation. And if we're distancing the way we should be doing and distancing their animals, where that's going to escape as a veterinarian. So it ties into some of the control things. But it's also important to realize that we get a lot of statements about no evidence of transmission from animals to people, which is very true. But we just don't have the ability to find that evidence very effectively. So it's trying to balance the line of the risk is not zero, it's probably very low, but since it's not zero, we still should be careful with our control measures.
And presumably, Professor Scott, this is something that, is being researched at the moment to get a sense of, animals living in infected people's houses. Are they converting? We obviously had the case in Belgium of the cat that was, supposedly positive, but it's knowing how accurately those sort of tests are taken and things as well.
Yeah, and that's the first step. So we're doing active surveillance. So I go into households and we sample animals of people that are infected. And that's telling us the first step. That's telling us how much transmission we get from human to animal. In that household, we can't answer any of the subsequent transmission questions because if everyone in the household has it, they probably got it from the person, not from the animal. But at least we start to identify, is it 1 in 100, 1 in 1,000, or 1 in 3? And that lets us figure out what those risks might be down the road.
And what sort of, in those very early stages, which I know are very early, are you getting a sense that, there are animals that are being infected in a house where there's infected people?
Well, we know there are for some other studies. We're just getting our testing on. We've sampled in the 30 to 40 range animals right now, and the PCR is just starting to get done. So I can't really, we don't have any positives yet. We haven't done a lot yet. We need to be getting into larger numbers. And there's also a time issue here. And this is where serological testing will help us ultimately. And that's the next phase of what we're doing. Because you have to figure out, okay, the person is infected, then they have to get diagnosed, and then we have to find out about it. And we have to get there and get the sample. During that small window where the animal's infected, it's still shedding. So we're going to underestimate probably to some degree by this type of approach. So we're going to answer a lot of questions, I think, in the next 6 months. But it makes it difficult to come up with risk assessments and preventive measures right now. So we have to err on the side of a little bit of caution, as long as it's common sense caution, not panic.
The serology is a more historical record rather than the PCR, which obviously can go negative relatively quickly, can't it?
Right, so PCR is going to tell us right now if they're shedding, if they're infected. And it's more of a challenge because of the PPE we need to use, the risk in sampling. Serology is nice. It's later in the game, but if the serological tests are accurate, in 6 months, if we test 1,000 cats, we can find out how many were exposed. And that will tell us, and we look at risk factors too, but that'll tell us the scope of that human-animal transmission. And, even finding something else, something out 4 or 6 months later is going to be relevant because this virus is going to be with us for a while.
And it was interesting that Dr. Scott made the point about using veterinary labs to help, with the testing. Is that something, Nigel or Michael, that has happened in New Zealand? Because New Zealand's obviously had a really good way of, moving with testing. Obviously also South Korea, Germany are 2 great examples of that as well. Have you been able to fulfill that just from your medical labs, or have you had to borrow some capacity from the veterinary ones?
I can just speak to that. So vast majority of the testing has been done in medical specialist laboratories, but there is one lab attached to the veterinary school at Massey that has now been doing COVID testing in people.
That's fantastic. I know in the UK that's still been really difficult to get the government to accept testing from animal labs. So it's an interesting area. I don't know if you want to comment on that at all, Daniela?
Yeah, so that there has been a One Health approach here, and certainly the profession has helped with things such as ventilators and things like that. Pirbright has handed over some of its capacity, as has Weybridge, to the testing of the human population as well.
That's great.
I could come in here too, Anthony.
Yeah, sure, Matthew.
We're getting reports from a broad number and a wide range of countries, the European countries, African countries, Latin American countries, where the veterinary laboratory capacity is playing an extremely important role. So it's very heartening to see that sort of One Health approach being taken, and in an emergency management situation like this, it's all hands to the pump. But I saw a comment pop up, and since we haven't mentioned it yet, in relation to the Netherlands mink farms, which is an extremely interesting situation. And the OIE has just this afternoon received the second report from the Netherlands Chief Veterinary Officer about this event, and we'll be publishing that on our website as soon as possible. So now 3 mink farms infected, and a really interesting situation of apparent animal-to-animal transmission within those farms, a set of controls going in place, and a really interesting approach from the Netherlands Authority that I think is going to generate a lot of very interesting information about animal-to-animal transmission under these sorts of conditions, and the generation of contamination in aerosols or environmental products. So that's going to be very interesting. But I would like to, I think, just step back from this question a little bit, because it talks about importance of animals in current pandemic. So not just COVID-19, and let's really appreciate the fact that in many of the examples of emerging disease that have resulted in transboundary spread over recent years, so many of them have an animal origin, and this is resulting from many anthropogenic factors, let's face it, in terms of the way we're exploiting wildlife, the way there's changes in food value chains, the lengthening, the diversification of food value chains, the challenges of traceability in those value chains, and the weaknesses in terms of veterinary public health and the regulatory approaches across those value chains. So all of those aspects, I think, are very important for us to reflect on as we think about our response, our medium and long-term response to the issues associated with COVID-19.
I know the Chinese authorities were talking about, some of these wet markets that they've had. They perhaps are going to really rethink that, because it does seem to be, one of the areas that has been a problem with these coronavirus, and obviously avian influenza viruses were, from those sort of areas, weren't they?
It's wet markets is such an interesting situation, and we know how important they are in the local context in many countries, in terms of the number of jobs associated with wildlife market chains, the importance of bushmeat, for instance. We know approximately 6 million tonnes of wild meat annually is marketed. Surveys across Africa, Asia and Latin America say that 39% of households are harvesting, and almost 100% of households are consuming meat from wildlife sources. And often the marketing step is occurring in these wet markets, where it's this confluence of live animals slaughtering and dressing with the public access to those areas under limited hygiene conditions that create the conditions for spread of pathogens.
Yeah, it is a bit of a public health nightmare, isn't it? So we should move on. Obviously, staying in a very similar area, focusing on the animal health issues, are animals COVID-19 vectors? And I'm maybe starting off with Professor Scott again on this one.
I guess the answer is we don't know. Potential, absolutely. And we look at actually two different areas. One is we look at the animals that being infected. The other is as a fomite or mechanical vector, whatever you want to call it. So, and that's actually not an insignificant issue, because we really don't understand that. So just to cover that aspect. So if I'm infected and I have my cat, and I'm coughing on my cat or touching my cat, have I deposited a virus on its hair coat? Well, probably. How long does it survive, and how much is there, are questions we don't know. If that cat stays in the household, it doesn't matter at all. But if that cat goes outside, interacts with feral cats, neighbors' cats, colony cats, or if that cat goes into a vet clinic or a shelter or somewhere else, then we've got that component. So when we're thinking about animal species as risk, we think about two. One is the animal that can get infected. But even animals that aren't susceptible to infection, we have to think about them. So in the clinical aspect, that's why we focus on querying health status of owners, because we're worried about the owners bringing it in, which is the main risk. We're also worried about hair coat contamination on a pet coming into a clinic. Then there's the infection standpoint. And certainly that raises concerns. And if we see more and more studies now where we get animals that can be infected, that raises the risk. When you get some experimental studies where you can see cat-to-cat or ferret-to-ferret transmission, that shows that there's potential maybe for sustaining transmission in a population. And if a cat can infect another cat, plausibly it could infect another person who has close contact with that. So we just don't know, and we're trying to walk the fine line here. We're trying to make sure there's increased awareness, because one of the challenges we had at the start was, the completely antithetical approach from a One Health approach was major agencies saying, well, there's no evidence animals can get infected. Well, there's absolutely no evidence either way, but trying to downplay the risk. And part of that, I think, trying to decrease fear. But we need to raise awareness so people take reasonable precautions and protect themselves and keep exposed animals from other animals without wanting them to abandon their animals or fear their animals. So it's an important educational point is, the risk isn't zero, but it's low, and here's what you do. And your cat poses no risk to you if you do these things. Like, that's the messaging we really focus on. But I think the answer to this is they're potential vectors. Absolutely, we have no idea, but you're much, much, much more likely to get this from a person than you are from an animal.
And almost moving on to the next question, which I think has a degree of similarity to it, but we can bring both factors in. What degree of crossover between animals and humans is there, and how can we prevent it? So I think it was Matthew was talking about the mink farms there. Do you want to make any other points on that, or add on to the vector, the fomite issue?
Well, I think probably when we're talking about this topic, I think Michael would want us to very important to point out that this pandemic's being driven by human-to-human transmission.
Yeah.
There's no actual evidence yet about an animal-to-human transmission event. Putting aside the evidence of the zoonotic origins of this virus. As Scott has said, we can speculate on the basis that there's experimental evidence where in cats and ferrets, as has been said, there's been animal-to-animal transmission under experimental conditions. And so we can speculate that obviously there's sufficient shedding of virus and infectious doses in those situations. But at this stage, very important to note that the pandemic's being driven by human-to-human transmission, and we really want to avoid, within all of this discussion about the zoonotic origins and bats, we know that there's been some very unfortunate reactions from some communities against wildlife in those settings, and we have to be careful to avoid that just as much as we have to be careful to avoid the issues of abandonment of pets and the animal welfare issues that can result if people take this risk that is at this stage speculative and act on it in ways that are unwarranted.
I think that was a very good point that Scott made. That if the information gets out too much, there's this fear environment that comes out, and as you say, people can start getting rid of pets and things, which at this point would definitely be inappropriate, I feel.
Maybe if I could just add one more point, because the other interesting thing here is the OEE gets asked a lot, how much animal testing should countries be doing? And this is a really interesting question. Particularly given the diagnostic capacity is such a important constraint for the public health response in so many countries. So we certainly don't want to see diagnostic capacity being diverted into low-risk animals when it should be focused on assisting the public health response. The OEE's just issued a guideline, and it's really, it emphasises that animal health authorities and public health authorities should be working together at the national level to define specific situations where animal testing might be justified. And then there's a range of considerations to take into account before those decisions are made. And within that document, we've issued case definitions and reporting guidelines as well.
It's interesting, Praveen from India is saying that similarly there, many labs and vet schools are supporting COVID testing in humans. So it's great to see this One Health approach that you've just spoken about.
Can I jump into the testing for just a second there, Anthony?
Yeah, sure, Scott.
So I think it's a great point about the testing. This gets into the clinical side more, but you're right. The general approach is to discourage testing. The access to testing is variable in some areas, but for me, the big thing that we're trying to discourage doesn't have an action, right? We only want to do a test if it's going to result in an action. For the patient, it doesn't mean anything because we're not going to treat it differently. From an infection control standpoint, I'm not going to say a negative means there's no risk. Positive would change what we recommend maybe, but I'm still going to say if you're infected, keep your cat with you. The other big thing from a clinical standpoint is what we don't want people doing is saying, okay, I'm freaked out about COVID. I want to bring my cat to the vet and get it sampled, which means I'm leaving the house. It means the cat's leaving the house. We have a contact point. We have a bite risk for information that's going to get us nothing. So there are some situations where testing is important. I think Matthew had outlined some of those big things. And there's some research reasons that testing is important. But, if 500 people test individual animals and none of that information goes together, that's 500 wasted tests. If we do a study that gets 500 animals, we put the information together, that could be really valuable information. But from a primary clinician standpoint, testing that's done outside of surveillance is going to have very little impact, and it's probably going to expose unnecessary risk.
That's great. Thank you, Professor Scott. Just moving on, because I'm conscious we've got quite a few questions. And perhaps this is one for Nigel. How does COVID-19 affect food safety, and can the virus spread through food? Over to you, Nigel.
Well, I think someone else was going to take that one actually, but Scott was going to take that one.
Yeah, I've got Dr. Scott as well. Yeah. Do you want to start with it then, Scott?
I can chip in.
Sure, I'm happy to. Look, I think that right now we have absolutely no evidence that this new coronavirus is being transmitted through any food. I think that, you know, a lot of the precautionary principles that we take related to food safety should be applied in this case as well. Obviously, a lot of hand washing associated with handling, preparing raw foods, keeping raw foods and cooked foods separated. And we also understand very well, particularly in lieu of the wildlife potential links here, that particularly when we're dealing with wild meat or farmed wildlife or these sorts of things, it's the same as with domestic animals and meat in general, that whenever we're handling, slaughtering, preparing, or selling any of these products, there's a need to really be sure that we're not preparing food from any sick animals or from animals that have died of unknown causes. And one particular thing that's come up a few times that we're seeing is that people are asking about whether packaging of food can result in COVID-19 transmission. Again, we don't think it's a very likely scenario, but I mean, a safe practice is to just make sure that you wash your hands after you handle anything packaged, and obviously cleaning the food products before you go to prepare them. And again, being careful not to touch your face. The last thing I wanted to mention is that particularly in some work with WHO, FAO, has developed some guidance on food safety for food safety authorities. And this policy guidance deals with various aspects of food safety, food security measures in light of the pandemic. I think that to ensure and maintain access to safe food, that we reinforce the implementation of existing standards, those that are outlined by the Codex Alimentarius Commission, and in particular on food hygiene and food import and export inspection and certification. Thanks.
That's great, Scott. I mean, we now shop once a week, and when we get the shopping home, if it's in plastic, we wash the plastic, and if we can dispose of it, we dispose of it, and obviously wash the food as well. So I suppose that seems like a sensible sort of approach to have, would you suggest?
Yeah, I mean, this is not necessarily any special precautions because it's COVID-19. This is basic food safety and hygiene practices that would prevent us from getting exposed to any other potential pathogen that's in our food. And it doesn't matter if it's vegetables, fruit, meat, you know, these same practices are relevant, and they can prevent us potentially from having exposure to COVID-19 if it's there. But again, there really is no evidence to show us that any food has been causing any kind of human infection. So we don't think it's a concern at this point.
And as you've said, just general public health procedures like washing hands is really, really important.
Sure.
Nigel, do you want to add to that, or are you happy with that?
Well, I think that was a great summary. And I think the conclusion that it really isn't a food safety issue. And in New Zealand, we've been providing a lot of advice and information to the food industry, but it's mainly around workers and avoiding transmission in the food production system, in food producing environments, particularly advice around PPE, potential transmission. And so that's been really the focus here.
We've got some questions just coming in, and I think I'll just share a couple if I may before we carry on. Keith is saying, I suspect that a serological test which is sufficiently specific would be much more challenging to develop than the PCR that is detecting the antigen. And maybe that's a question. He says, is that correct? It's a question for Professor Scott.
Yeah, potentially any test needs to be developed properly. The good thing about serological testing is, you know, blood sample quality isn't really an issue. For getting nasal swabs and pharyngeal swabs and the like, sampling quality becomes an issue for PCR. But they're just two separate tests. They're doing two separate things.
Yeah.
I think the high quality serological test should be achievable. It just needs proper quality control, and I think it'll help us a lot. But it's a PCR test you can certainly get done quicker.
There seems in the UK to be the Roche test, which is now trying to be rolled out in the UK to kind of see what the historical infection rate is like. So that's the latest news from UK, certainly.
Anthony, just before we move off this question, I'd just like it to take it in another couple of interesting directions, I think, because one of the things that I'd like to talk about the impact of COVID-19 on food security internationally, and I know that that's a big concern to a number of international organisations, FAO, WTO, IFAD. So what we're seeing disruption of food supply, and one of the things of most concern to the OIE is we're also seeing examples where countries are introducing, on the basis of rather flimsy evidence, as we've already discussed, a range of sanitary and phytosanitary measures against animal and animal product trade, including meat and other products. And this is something that we really want to avoid, because there's enough disruption to international food supply at the moment that avoiding these unjustified barriers to trade is something that we're very keen on emphasising. We've just had an expert group working together to produce a set of recommendations on safe trade of animal products, and really they've emphasised that there's no real scientific evidence that would justify SPS, as we call it, sanitary phytosanitary measures on the international food supply. So that's an important point to make.
That's great. Thank you so much for that, Matthew. Just moving on to our next question, which is the public health impact of COVID-19 is wider than the disease itself. Is this avoidable, inevitable? Can it be better managed? And Michael, do you mind taking that one?
Sure, and I agree. I mean, the effects of this event are obviously profound, and you could think of almost that typology of the direct effects of the pandemic, which obviously health effects for those affected, and also psychological effects on many people. And some of those effects are obviously acute, but also some are long-term, and some of those long-term effects are only being identified now. Certainly, if someone goes into an ICU and is ventilated, they've got maybe a 50% chance of surviving, and even amongst the survivors, there's often a lot of long-term effects. But then we've also got the effects of the pandemic response itself. And in a country like New Zealand, where we are hoping that the pandemic is largely under control, the response itself is having a devastating effect, particularly on low-income families. And we can see also the effect on healthcare systems that are completely overwhelmed, and that obviously has other indirect effects. There's the global economic recession, and also wider societal disruption and security concerns. And the question is, how many of these things are inevitable? How many can be avoided? Obviously, and we'll get onto this, if the pandemic is well managed and contained, that's going to reduce the impact, the direct effects. Some of these effects are, of course, in a way unavoidable for many of us, many countries, in terms of the global economic effects. But clearly, and going back, for example, to that last example about agreements about trade and tariff agreements, and really supporting our global health institutions so they can work to minimize some of those adverse unintended consequences of the responses that countries have, which often involves travel restrictions. So again, I think there's many things we can modify about this.
That's fantastic. Thank you for that. Does anybody else want to add it in there? Any thoughts?
Anthony, I would love to chip in here. It's Dr. Scott.
Yeah, hi, Dr. Scott.
Okay, thanks. Yeah, I mean, this is really the wider effects of COVID-19 measures and the implications that they're having is very much at the heart of what a lot of the work of FAO is focusing on. We're really looking a lot at understanding and mitigating the pandemic's impact on food and agriculture. And we're also looking at safeguarding the food security and livelihoods of a lot of vulnerable people. I think that to a large extent, the approach that's being taken is angled through a public health lens, and that's exactly how it should be. But I think that what we're seeing is that some of these measures are inadvertently causing very big challenges for a lot of vulnerable people, people who are food and nutrition insecure, as well as the rural poor, who many of them rely on agricultural livelihoods to survive. So just to try to give you a concise snapshot of these types of impacts, we've been undertaking some assessments at country level to try to look at where the measures are having the greatest impact. And certainly we see at farm level, producers are having challenges because they don't have access to labor. They can't get inputs for production. And in the case of livestock, this might be animal feed, fodder, vaccines, medicines. The impacts are also along the value chain. So once you have products, you need to move them either to middlemen or to the markets themselves. And particularly in the case of perishable goods, milk, cheese, fresh fish, meat, these are very much dependent on refrigeration and rapid transport, and this is really being impacted. And then we also see even exports, international exports, because borders are closed. And it's not necessarily international big exports, it's even just neighboring country exports that are also being impacted. And then the last challenge that I think we really are seeing, particularly in Africa, is that despite its potential for farming and agriculture, we recognize that a lot of African countries are dependent on food imports to feed their populations. And so the importation and the movement of food systems being crippled by transport changes and by limited movement of people and whether it be planes, boats, vehicles, this is really challenging us. So I think one of the other elements is to talk about how we manage this. And to me, again, we're back to a One Health approach. And more we're seeing as this goes on that countries are becoming more aware of the implications of these health measures that are being put in place. They're taking better whole of government approaches. And we really need to accelerate this approach to try to alleviate a looming food crisis. We know that that's a concern. FAO has co-convened a meeting with the African Union, a ministerial meeting, and there's actually been a declaration put out on food security and nutrition highlighting exactly this issue, and then trying to concurrently deal with health crisis, facilitating food and access to food, and also thinking about the safety nets that need to be in place to protect the most vulnerable.
Mm. Obviously, governments are taking quite widespread actions to protect people with, injecting money into the economy and so on. I suppose the other issue is hospitals are becoming places that people don't want to visit. So actually, other diseases are not being treated. Are you seeing that, Michael, in New Zealand? Is that the same kind of, the hospitals are quiet because people don't want to go in, or is that coming back now as the pandemic seems to be getting controlled in New Zealand?
Yeah, well, people were actively discouraged from going to hospital, and a lot of deferred, a lot of elective surgery was all deferred. So because the pandemic was well contained in New Zealand, the hospitals were empty for 2 months. It's actually a good time to go there if you had to have something done in a hurry. So an unusual situation, but I think it's much more crippling if you have a prolonged pandemic. And you're right, I mean, people want to avoid hospitals because of the risk of infection in that environment.
You're now coming out of that, whereas obviously the UK is still in the middle of it with, large numbers of new cases each day. So we're going to talk about that in a little bit, so we can perhaps come back to that. I'm just looking, perhaps just to break up for a minute or two to ask a few questions coming in from the audience. Marinas is saying maybe it's just by accident, but in the US as well as Germany, Labour men in pig slaughterhouses were COVID-19 infected. Could that be a risk? So I don't know if that's, does anybody want to take that question?
Right. Scott, I guess maybe Mike, I don't know as much about that, but I think the point for the transmission is just, if you look at the slaughterhouse and these meat production plants in the US, at least or in Canada, it's massive numbers of people in very, very close proximity. You see lines of 100, 200 people right next to each other. So it's not an issue they got it from pigs. We were concerned about pigs
Yes.
initially based on theoretical risk, which doesn't seem to be much of a concern. It's just a matter of you get one person in there, a lot of people are going to get it very quickly.
Yeah, exactly.
Yeah, that's been a real challenge here in New Zealand, is around the physical or social distancing, how you manage that within plant. Virtually impossible. Big focus.
Yeah, or in schools or any place really, isn't it? Another question, would any of the panel like to suggest what proportion of any population, e.g. of a country, needs to have some immunity from infection or vaccination to significantly reduce the risk of new outbreaks? That's still very interesting, waiting for the information to come in, but I don't know, Michael, if you want to have a first crack at that one.
Yeah, I mean, at the simplest level, if it has a reproduction number of around 2.5, you need to have 60% of the population vaccinated or immune somehow to interrupt transmission. It doesn't totally interrupt it. You'll still get small outbreaks and some ongoing transmission. Ideally, you'd like to have much higher coverage than that, particularly for a serious illness like this.
Great, and I don't know if Professor Scott wants to make a point there.
No, I think it's covered. Maybe the other point I would have is people keep asking whether we're there with herd immunity. We're a long way away.
Yeah.
Just looking at our Canadian numbers, like we have 71,000 confirmed positives in Canada, and that's tests, not necessarily people. So people might be a little bit lower. Even if we're under diagnosis by a factor of 100, we're still in the 20% herd protection range if we have immunity. And that's also assuming that there is solid long-term immunity post-infections. There are a lot of ifs. And I think the take home for me is if we're waiting for even 60% immunity to be protected, a lot of people are going to die. So that's why we're trying to keep things at bay until there's a vaccine or until there's better treatment. We can't just say, well, eventually everyone's going to be immune, because the case, but it's not going to be a good way to get there.
I think in the UK, we're talking about 10% at the moment. There's different figures obviously coming out, but it obviously is still similarly, quite low. If we could just move on to the next one, which is about vaccination. When do people think we will have an effective vaccine, and will the vaccine mean the end of the pandemic? So picking on you a little bit here, Michael, but do you want to have first crack at this, seeing as you're the doctor?
Yeah, I think there'll be other people who can comment on this. There's obviously huge efforts underway to find a vaccine. There seem to be the optimists and the pessimists. I mean, the pessimists say, well, we don't have any effective vaccine for human coronaviruses at this stage, so it's a bit of an unknown goal. And obviously there's some viral infections we've never found a vaccine for, so that's the more bleak view. The other is that there's so much effort going into this that with newer methods that people are quite optimistic. Maybe 18 months is the sort of shorter end, maybe slightly less. But others can probably comment on this as well.
Yeah, I think, Nigel, do you want to have a go at this as well?
Yeah. I mean, it's a really interesting area. Obviously, there's huge investment at the moment and billions of dollars going into vaccine development. And I think at the last count, it was over 130 different vaccine candidates, 8 of which have gone into human trials now, but that's just really first and second stage. There's nothing in stage 3 in exposed populations at all. So there's a lot of work that still needs to be done around safety and efficacy. And as Michael says, it will take months, possibly years, to develop a vaccine. And even then, it's going to be quite likely that ultimately it will become endemic and possibly a seasonal infection. So we'll need further top-ups of vaccination in the future.
It's interesting watching everybody's lights changing with the passing of the day. I think Grant's got the best job. He's in his car, and it looks like it's great. A lovely sunrise there. It was getting a bit dark in the room, so apologies. I just jumped off to turn my light on. Should have thought about that before we started. But Scott, I don't know if you want to talk about this as well, because obviously with cats, we've had real problems finding a coronavirus as well, haven't we? So do you have any thoughts on this?
You're talking Canadian Scott? Yeah.
Yeah, Canadian Scott. Professor Scott.
My guess is probably as bad as anyone else's. They'll always say we don't have a vaccine for this, that, and the other thing, but no one's put anywhere near this much time, effort, and money into any other vaccine, right? Yeah. So I think that, getting a vaccine is one thing. Getting 7 billion people or whatever we are vaccinated is another thing. Like if you, I said,
Yes.
example I said today is if we had 100 million doses in Ottawa in Canada that we vaccinate every person in the country 3 times. How long is it going to take to get everyone vaccinated? A long time, even if we had all those vials sitting there. So it just brings into the whole time concept, right? My guess is, my hope is, we're going to have an effective vaccine, but I'm not holding my breath that we're going to have it in 2020 or even by next year at this time would be nice. But I think to get effective vaccination, especially in developing countries, where we really need to have vaccination, in some densely populated countries, there are going to be so many challenges there.
As you've said, it is a real logistical nightmare to get those vaccines out quickly, isn't it, as well? Dr. Scott, do you want to have a go at this question as well? Oh, you're just muted at the moment. That's great. Oh, you muted again. You must, yeah, that's fine.
Yeah, I just wanted to just compliment what Scott was saying, that, if we did have a vaccine available, I think the delivery to people is going to be another large delay. So, whether we're talking about a year, 2 years to have a vaccine, if you can imagine that, okay, we may have more people living in cities these days than in rural locations, but still there are millions of people in very remote locations, and these are hard to reach people. And then we have cold chain issues to try to get vaccines out there. So, and then you have a human resource delivery mechanism. So I think, this is a big challenge for us at a global level.
And we've seen the logistical problems of having the testing, having the PPE, for even quite well-developed countries like the UK. So I suppose it's even more challenging in some other countries as well.
I'd just like to add to that too, these equity concerns, which I think come through every aspect of the response, and obviously with vaccines as well. And we can look at the challenges even with polio eradication, which has been very stubborn just because of delivery across the planet. And I know the question said, what will this mean ultimately for the pandemic? Well, it does depend, I think, on having equity as a major driver for this and other aspects.
Yeah. No, that's a really good point. I'm just checking again if there's any interesting questions that relate to that.
Anthony, if I may, just
yeah,
I think
sure, Matthew.
There's an opportunity in this discussion just to really mention the international scientific collaboration that's been going on in this event, which is really quite extraordinary. And starting off with the GISAID platform, which has 24,000 COVID-19 genetic sequences that have been uploaded, which has just given incredible insights into epidemiology, but then also targets for treatments or vaccines. The platform that the WHO is set up with the clinical trials registry. So all of this effort is just really quite extraordinary. The way scientific collaboration, and possibly in stark contrast to the strategic collaboration between governments, which has been kind of exposed in this event. It's very heartening to see that scientific collaboration is alive and well through this event.
I think the knowledge that we've learned so quickly and being able to set up tests, I remember the early stages of this, somebody was saying when AIDS was first discovered, it took so long to get whereas things have moved very quickly, as you say, with the scientific community. So yeah, no, that's really fantastic. There's a couple of questions which we may or may not know, but I'll throw them out to see if anybody can answer them. In what temperature range can the COVID-19 virus survive? So in the warmer southern climates, has that had an effect? Do you think the fact that you have had a warmer climate, has that protected the southern hemisphere, and will that kind of reverse once summer is in full swing in the northern hemisphere. Does anybody have any thoughts on that?
I don't have any data, but it's an envelope virus. It doesn't like being outside the host, so it's going to die very quickly in whatever temperature. Coronaviruses tend to like it to be a little colder than warmer. So I think, you know, sunlight's going to kill it. Desiccation's going to kill it. Warm weather might. We can't rely on warm weather to be what's going to fix this for us, though.
Yes.
Environmental transmission, you know, we pay attention to it, but it's human-human droplet-based transmission, which is the main concern. And the environmental conditions aren't going to play too much of a role there, at least during the first year. As you start getting into a seasonal, if it becomes an endemic thing, then maybe there'll be more a seasonal effect. But right now, I think my impression is we're not too concerned about the environmental conditions having a big impact on transmission. Someone may know better than I do, though.
The other question was about mutation rate. I know that there's now, I believe, two forms, the S and the L form. There may be others that have started to come up. Do we get a feeling that this may be a virus that will mutate easier than some others, and will that cause more problems with disease, but also with creating vaccines like the influenza virus?
If I could just say something to that. So, I mean, it is mutating and evolving, like all viruses do. I think it's compared to other viruses, such as the flu viruses, it's not evolving or short-term evolving at such a rate. And it's always possible that it could become more or less virulent, and it's possible that it could result in variation, which might make a currently developed vaccine no longer effective. But at this stage, we just simply don't know. And, you know, as I say, a lot of the genomics is really going to help in this regard, but we don't know exactly. Can't predict what's going to happen.
I think one thing to remember is there's mutation and there's mutation. It gets easier to write it out. There's mutation and there's all caps with lots of things mutation. Mutation can be an academic curiosity, right? It can be interesting to look at. It can be great for molecular epidemiology. It could have no impact clinically or in terms of protection. So, like, this is an HIV. It's something to pay attention to, but I think people get freaked out when they see reports of mutation in different strains. It means, okay, we're never going to have a treatment or a vaccine. This is much less of a concern.
I know, reading about potential symptoms, Michael, that there is the possibility, we talk a lot about the respiratory element, but I know some people have had, you know, diarrhea, gastrointestinal problems as well. There is a question here, do we know how long the virus is excreted in the feces for? Also, are the people who get it very mildly likely to carry it longer or even become persistently infected in a relapse, recover type of picture?
There's quite a few questions in there. No, I think there doesn't appear to be a persistent infectious state. One of the problems, of course, is the testing is so the PCR testing is so incredibly sensitive that even after someone's recovered, you can detect a trace of the virus for weeks, maybe months in some cases. So that's why retesting is not usually recommended. In terms of the role of feces is, I think, still very uncertain. I mean, it's a theoretical possibility, but there haven't been, if it was important, I think we would have seen outbreaks of fecal-oral transmission, and I don't think that's been documented. Someone may be able to correct me on that.
Great, thank you so much, Michael. We'll move on, I think, to the next question, if I can bring that up. You know, clearly we are all in awe and amazement at the fabulous job that New Zealand are doing at the moment. Can you maybe tell us a little bit about that approach, and do you think that that is the approach that other countries should be taking, or are there certain reasons why this was the correct approach for New Zealand, but not maybe for some others?
Yeah, I think this was the approach New Zealand took. And of course, we weren't the first. We were just following Asia. And this is, I think, when we finally look at how the globe responded, this will be seen as a major policy failing in the West and risk assessment failing. And we can see now that if you like that typology of approaches, there are those countries that have gone for containment, or you can call it elimination, and those, and some countries actually even more extreme than that, where you could say have excluded the virus, and that's some Pacific islands that just didn't have the capacity to actually manage any cases at all if it arrived. So you've got at one extreme exclusion and elimination, and then the other group are those that took the traditional mitigation approach, which is really written into our pandemic planning, and it's designed for influenza, where containment isn't really an option. And so I think that's one of the problems, that every country in the world had a pandemic plan based on influenza. And it seemed like the West was expecting this pandemic to wash over them, and all they could do was kind of flatten the curve and mitigate the effects. And so within those countries, mitigation proved to be a disaster, and so they very rapidly moved to suppression, which is where most high-income countries are at. And if you think of the third block being low and middle-income countries, generally they are doing very little or some slight mitigation. So this was certainly a realization I had quite early on, and some other people as well, that particularly by February, you could look at the information coming out about China, who of course did a remarkable thing of stopping a pandemic in full flight in Wuhan and Hubei. But I think there was initial suspicion of whether that had really happened. But I think the thing that certainly changed my own mind was seeing that joint report from the WHO mission, which was published in late February, and that really did document how effective containment was. And so by mid-March, when New Zealand had about 100 cases and no fatalities, it decided to adopt that elimination approach. And that's not, the difference is you still got the same fairly crude techniques for containing this infection. And you could say they're almost slightly medieval. They're obviously pre-vaccine and pre-therapeutic era approaches. And that meant instead of ramping up your response as the pandemic intensified, which is a mitigation model, you throw everything at it at the start. And the goal is actually to eliminate transmission or get it to a very low level. But if you can achieve complete elimination, it has those huge advantages. You can obviously reduce the burden of disease, but also you can come out the other side into a society where there is no longer transmission. And I think all of us in infectious diseases know the elimination eradication model, where elimination applies to a single country or region, and eradication is the global approach. And I think actually in the veterinary world, you do this better than in the human world in terms of that very systematic approach. So New Zealand went that way basically, and it used a number of different methods that I think are pretty familiar. Obviously managing your borders, having intense, that's the keep it out bit, the stamp it out bit, with contact tracing and so on, and then a huge amount of surveillance and testing.
How do you see that moving forward now that, you know, New Zealand is not seeing new cases at the moment, or very few? Will it make it very difficult for it to open itself up? I know that at the moment there's 2 weeks quarantine. You're talking with Australia as a potential, because both countries are obviously doing things really well there. Is that going to have an effect in your ability to, you know, allow people to come into the country from other countries?
Yes, I mean, quite clearly, you have to be very keen to come to New Zealand or Australia or several countries now, because it's going to be 2 weeks sitting in supervised quarantine. But what we're going to see, I think, is and this is obviously a scenario, but we could look at the Eastern Hemisphere now. You've got China, 1.4 billion people who are sitting inside, if you like, this protective cordon. And they have a long border, which they are managing, but they will have outbreaks, of course, small ones. You've got Taiwan, which is, I think, the model response. They acted so quickly they didn't need a lockdown. And then you've got Hong Kong, which is largely had a small outbreak. You've got South Korea, Singapore, and I think soon we'll have Japan, because that's the direction they've been going in. You can have quite significant outbreaks, but tentatively the definition we're using is 4 weeks with no cases in the presence of a high-performing surveillance system. And obviously you have to accept that you have some cases quarantined at the borders, and they don't contribute to your achievement of elimination. So fairly logical kind of definitions. And interestingly, no other countries yet have a defined definition of elimination. So it might be something where New Zealand can get together with other countries and work that out, possibly with World Health Organization involvement.
Yeah, it's really fascinating. I don't know if anybody else wants to add to this. Nigel, do you want to make any comments?
No, I mean, just apart from the obvious parallels that Michael mentioned with animal health, I mean, it's been really fascinating seeing how the find, contain, control approach has been used in New Zealand. It's obviously very similar. We've also got another outbreak ongoing at the moment, which we're trying to eradicate in animals, the Mycoplasma bovis. You really see the parallels going on between the two. I think longer term, obviously we have an immunologically naive population. There is a risk of a second wave or even subsequent waves of infection. So the emphasis really does have to go on testing, tracing,
biosecurity,
management at the border as well. There is at one point that we do in New Zealand obviously have a big advantage, is that we are an island nation. We're relatively isolated, so things like tracing are likely to be more effective than in some other areas.
Just perhaps, moving on to the other approaches. Obviously, you've mentioned South Korea and countries like that. Germany seems to, within Europe, have done rather well compared with the UK and Italy and Spain. Will some of it also be around how deaths are being reported? I know in the UK there's a controversy at the moment whether the deaths have really gone quite high, above what would normally happen, and many of them, doctors aren't going to nursing homes, so they're not putting them down as COVID-19. Could there be a reporting issue here that's perhaps making it difficult to know really what the true numbers are?
Yeah. Could I, just also commenting on the alternative scenarios for other countries, because this is a thing that really intrigues me, is in Europe, you have some countries now pursuing a very intense suppression approach. And I wonder if they are going to eventually aim for elimination, because some European countries are achieving this, because otherwise you're really doomed to be going in and out of a form of suppression long term, because you haven't eliminated the virus. There's also the other alternative, which of course is Sweden, that we're all watching. And that's, I think, the only country that is still actively pursuing what is now called the mitigation approach. I don't like to use the herd immunity approach, because I think it's a term I've always liked, and we don't want to sort of ruin that term. This is the great unknown, is if you have circulating virus. I mean, it all looked very good in theory, and the UK and the Netherlands were following that same path and then decided it was too destructive. But I'm interested to know if there's still support for the Swedish model, because I think it is. It has been described very articulately, and I think if it was a different virus, it might have been the least harmful option for some countries. And I'm thinking particularly low-income countries where elimination or even suppression is impossible. And I think we've done a major disservice to many low-income countries by suggesting that they should just follow the same model as in high-income countries, and do, obviously testing is useful, but divert all of their resources into a method that just isn't sustainable for them. Whereas I think if maybe a form of mitigation where they focus on protecting vulnerable people would actually be the most sensible. I'm just interested in what people think. Or will the virus make this impossible? Because if it doesn't create high levels of immunity, then the mitigation model is going to be also is going to fail.
No, there's some really interesting points there. Does anybody in the panel want to add to that? Both, the New Zealand approach and obviously the other approaches, the American, the UK, Netherlands, Germany, Austria, some countries, Switzerland, are doing, better than others. Does anybody want to make a comment on that? I think Dr. Scott's keen to say something here. So over to you, Scott.
Yeah, I'll maybe speak on behalf of a lot of the developing countries and maybe give you a snapshot of the the challenges being addressed here in Africa. You know, before COVID hit, we already had a major issue related to over 160 million people being food insecure, 113 million being undernourished, millions of children malnourished or stunted. And then we also have a lot of extremely poor people. We also have a desert locust situation, which is affecting, you know, maybe 20 some odd million in Kenya, Ethiopia, Somalia, Uganda, South Sudan. And then there's also a lot of displaced people because we have a lot of civil unrest, climate change, drought, and conflict. So, you know, this is as Michael was alluding to, you know, the pressure to follow suit with what the North was doing when this virus really started to infiltrate Africa was really a challenging and tricky issue. We also recognize that the public health systems don't really have the capacity or the infrastructure or the supplies to keep up with the detection and tracing that's going on, given the rapid progression. And so, you know, we know that governments, a lot of them, probably over 80% of the countries in Africa, put in some kind of movement restriction management control methods. And only, I think, about 7 countries have not gone to restrictions of movement. And a lot of, you know, only 5 countries have airports open, 8 have their borders open, and 14 have seaports open. So to a large extent, there's a lockdown taking place. But what's being observed, and I think this is really at the heart of the challenge here, is that the lockdowns are inflicting an enormous hardship on people who really depend on income on a day-to-day basis to buy food for themselves, to buy food for their families. And this daily reality is the reality of millions of people here. And so, you know, we also recognize now that the social safety nets that are in place are not as robust or resilient as we would like them to be, because they're not reaching the large masses of people. And I think that while we want these measures to be in place to prevent a health disaster, further spread of the virus, it's really difficult because the leaders here are balancing food and nutrition security and poverty issues against the known techniques for controlling the spread of the virus. So it's a tough situation. And I think that the last point I'll say is that you know, there's been a lot of closure of informal markets and food stalls and these sorts of non-supermarket-like facilities. And while I understand the intent for that was really to prevent, again, infection spread, the reality is that these informal markets and locations are where, again, most people go to get food. It's usually a source of cheaper food. Most people are not going to supermarkets to buy their food. And so, you know, if we close them, we're looking at impact on maybe the 1 or 2 meals that people can afford in a day. They no longer have access to diverse and nutritious food on a regular basis. So, you know, we're stuck in a tough situation, because if you think about keeping them open, how do you implement social distancing and the other types of disease prevention measures at the same time? And so anyway, this is really a tough situation, and it's still unraveling here.
So Scott, do you think that lockdown, obviously the wrong way maybe to go in Africa, and maybe that sort of allowing it to move through the population is the better of the 2 evils almost?
Yeah, I mean, you know, I'm in it's a tough situation to call. I mean, I think, you know, some type of loose lockdown or some type of adjusted lockdown, obviously based on the infectious disease dynamics, you know, we don't want it to just explode throughout the populations. I mean, we've seen what happens in some countries in Europe and Asia if that starts to take hold. We don't want to have that. But at the same time, we have such a poverty and food insecurity issue that needs to be concurrently addressed.
And maybe more protection for the elderly and the vulnerable, who are, as we know, these comorbidities seem to be, you know, really important factors of those who get the disease in a mild fashion and those who get it in a very serious fashion. Michael, did you want to make a point there?
Just one additional point that has been something that I've observed more recently is the evidence for mass masking, I think, is very compelling. And some analyses suggest that it's as effective as a lockdown and much more sustainable. And these are simple fabric masks. If everyone wears them, there's some modeling suggesting that can actually interrupt a pandemic. And that's, I think, again, example of Western arrogance, that we've been very resistant to masks, yet all of the countries that have responded effectively have this as a key strategy. So, and it is quite sustainable, I think, in low resource settings.
Are you using
we're seeing
masks?
that. Sorry.
Yeah, go on, Scott.
Yeah, I was just going to say, I mean, you know, this has now become actually where I'm staying in Ghana. This is a regulation. If you go out of your house, you have to wear a mask. There is no longer a hard lockdown. There's still not large social gatherings allowed. But if you're out going anywhere, mask is required. And I think, you know, there might be some merit to this because, you know, while it's not perfect, it seems to be dampening the volume of cases that are showing up.
Fantastic, Scott. Would you say, Michael, that's where you're moving into, you know, internal spaces, whereas, you know, I feel correctly or not correctly that if you're outside, you know, exercising without lots of people around you, that probably, you know, I haven't been wearing a mask, whereas I can see there is a movement towards wearing masks in supermarkets and things.
Yeah, I think it's very much the indoor environment where almost all transmission is occurring. And people are saying, well, actually, it's far more effective than hand washing. When you look at how this virus is transmitted, it is that contact between people, indoor environments, before they're getting symptoms, that's where most of the transmission appears to be occurring. And if both people are wearing a fabric mask, it seems to be extremely effective at interrupting that mode of transmission.
That's a really great point. I think it's so important. Whenever we do a webinar, I always say I should learn something from it. So tomorrow when I'm going down to the co-op, Michael, I'll take a picture and put it up on social media for you. I'm hoping I'll look quite fetching with it as well. Moving on, I think, to the next question, unless anybody has a desire to speak about that kind of the different approaches that we're all taking around the world. Otherwise, I think we'll move on to how specifically veterinary organizations can kind of help in playing a role to inform the profession and the public about COVID-19 impact and how important lobbying is. And I asked that question, you know, Daniela has been doing a magnificent job in the UK with regular communication with the profession. BVA is a very effective lobbying organization, you know, into government and parliament. So perhaps, Daniela, I'd like to just pass that question over to you, you know, as associations, and then obviously we'll bring in OIE and obviously NZVA to see what grants been getting up to. So over to you, Daniela.
Sure, thanks, Anthony. I think the importance of veterinary organisations, I don't think, has ever been as clear as it is now. You know, if we think about members of the veterinary profession, they're human like everyone else, and so they will be having the same anxieties, the same uncertainties as the rest of the population. And if you put on top of that, you know, the anxieties of trying to run a business, trying to maintain staff safe, trying to maintain animal health and welfare and public health, and certainly in the UK, our 24/7 out of hours care requirement. And so BVA, certainly we felt it was very much our place to make sure that we were there, that we were supporting, and that we were communicating as much as possible. And our work over the last few weeks has sort of had three prongs to it. And the first one has been collaboration. So from the beginning, I have been very clear that we are all in this together, and it was vital that all the veterinary organisations worked together and that we had a united front to deliver a clear message, because what we didn't want to do is cause more anxiety. And certainly it has been incredible watching certainly the UK veterinary profession come together from all aspects and work really hard here. The other issue we've had is translating sort of the government guidance into the profession aspect. So, you know, the veterinary profession is a mix of people, some that wanted, you know, stark, harsh rules, I can do this or I can't do that, and others that wanted the freedom to use their clinical judgment. And certainly our focus has been on how do we interpret the government guidance to help members of the profession. And, you know, at first when our Prime Minister announced the lockdown, it wasn't even clear if we could stay open. And so our initial guidance was very much only emergency work should be carried out. And our most recent guidance is a traffic light system to help vets with their clinical decision making. but also the practical aspects. How do you socially distance in practice? You know, how do you, it's been mentioned that the outdoor risks are lower than the indoor risks, and certainly for our farm colleagues and perhaps our equine colleagues, the anxiety was slightly less, but for our small animal colleagues, there was a real anxiety there. You know, it's high throughput work, lots of people, and so a lot of our advice has been framed about how do you carry on veterinary work in a manner that allows social distancing. But in all of this, we've also had to, as an organisation, manage client expectation. So client expectation has been a real sticking point in the UK, both in terms of farm clients, for example, and not adhering to or not respecting the vet's guidance in terms of how to maintain social distancing. And in small animal practice, the pressure from clients to do things that perhaps right now would not be appropriate to do, that, you know, there's not an urgent animal welfare issue here and we can't do it in a socially distant manner. And so it has been about collaboration, translation national rules, and also managing client expectations. Now, it's been touched on in terms of the financial impact that this pandemic is having across the globe, and you know, the veterinary profession is not immune to that. And certainly, as a lobbying organisation, we have had a real strong lead there in terms of lobbying the UK government for additional help. The UK government has put together some excellent financial support packages, but in some aspects, the profession has fallen between the gaps. And there is some data showing that, you know, a lot of practices in the first 3 weeks of this lost 75% of their turnover. And, you know, I know we're coming on to questions later about the long-term implications for animal health and welfare, but if we don't have sustainable businesses, we won't have, you know, the vets out there to do the work that we need them to do. So it's been very much, as you say, Anthony, about communication, collaboration and support as well through these last few weeks.
And I know you were very involved in the whole furlough system because people were worried that if somebody was furloughed, you know, when could they come back? And I know now there's a very flexible, you know, some people are doing furloughing for 3 or 4 weeks and then they're coming back into the business while the other half get furloughed. So there's been a lot of flexibility, which I think without the BVA, that perhaps wouldn't have happened.
And there's the Chancellor in the UK certainly announced further flexibility in furloughing, because at the moment, you know, the minimum amount was for 3 weeks, and then there's flexibility after that. He's recently announced that there will be perhaps part-time elaboration there. We're waiting for the details, but it appears that there will be increased flexibility there, which will certainly be welcomed by the profession in the UK.
I would encourage people who were on listening to the webinar, please do feel free to tweet #WVAC 2020 or make a comment on Facebook. It's always good to hear what people are thinking, and I will obviously try and get through some more questions as well. Grant, you know, how has the NZVA been supporting the rank and file vet in the consulting room or in the field?
Yeah, thanks, Anthony. Yeah, very, very similar to what's happening in the UK. You know, focusing on a whole bunch of issues that are becoming relevant to vets. Well-being, particularly with the unknown and the uncertain nature of what we're facing and the financial impact has been a little bit variable as well, depending on what type of practice. Strangely enough, the equine practices were the most hardly financially hit initially, just given the time of year that it was. Large animal practices have generally performed very well. Small animal practices often down 50% or more. But it's certainly supporting, you know, we are a member organisation, so that's what we're there to support. We're lucky in New Zealand, being a small country, a relatively small profession. We have a very good and close relationship with our government Ministry of Primary Industry, with our veterinary council, and because we only have one veterinary school with that group as well, so we actually have weekly catch-ups with that group, and we're very much on the same page. A fairly small group of us, in effect, are writing the template that how vets should be performing their duties, and touch wood, so far it's gone really, really well. So certainly we are lobbying. It plays a very important part, and keeping our members informed. because it's I suppose if it's taught us anything, it's taught us to expect the unexpected, and challenges can pop up in strange and areas that you wouldn't necessarily see problems coming from. An issue we're going to be facing shortly is New Zealand relies each year on specialists coming in from overseas for different parts of the industry. The equine breeding industry, which is an important part of the New Zealand veterinary industry, often does rely on a number of specialists, particularly from the US and the UK, coming in for the equine breeding season. Some dairy cow work, again, relies on specialists, and with closed borders, that looks like it's going to be a challenge. So, there's lobbying work going on to work out how we can help with that. But it's certainly been challenging, but it's also been rewarding, being part of a high-functioning team that's delivering some really good support for our members.
And just obviously, the government and the advisory board have done such a great job at controlling the disease. Is the New Zealand government being responsive to supporting businesses and individuals? So is there a good support mechanism there for, low-income families that aren't earning money, for businesses that, might be struggling and may go under without some support? So what's happening from that perspective?
Yes, there is certainly an awful lot of money being put in by government. I think that there was a budget that came out 2 days ago that's going to, over the next 1 to 2 years, going to in effect add up to what is 50% of New Zealand's GDP, which is a massive number. So initially we had wage subsidies, which allowed us to keep supporting business, supporting our staff and keeping them on board, and ongoing packages like that. So on the whole, although different industries in New Zealand are obviously affected to different degrees, veterinary is going to be certainly one of the lighter effects and is reasonably resilient. Obviously, we've got the effect of the disease, but then as we get through the lockdown period, we've got the effect of the recession. And we're used to straight out financial recessions. We're not used to recessions caused by pandemics. So there is certainly some uncertainty and some unknown. I think the last time New Zealand faced a pandemic as a result, or a recession as a result of pandemic, was the Spanish flu back in 1918. So it's fairly unknown waters. But no, there is a lot of money coming in and good support.
I know Matthew wanted to touch on this one as well. So any thoughts, Matthew, for OIE?
Yeah, sure. So, starting with the lobbying question, and I have to really give credit to the World Veterinary Association when they approached the OIE very early on in this pandemic, when countries were putting in place the sorts of lockdown measures that we've seen, and from that approach emerged the joint statement between WVA and OIE of veterinary services as essential services, which we know has been an important point of leverage at the national level among many countries to have the international organisations issuing a statement like that and giving support to the fact that veterinarians, if we're classifying food, the food chains as essential services, the role that veterinarians and other professionals, I should say, play in supporting those food chains is very important. And when I mention other professionals, it was very interesting that a couple of weeks after that statement was released, the OIE was approached by the World Renderers Organisation, and we expanded our statement to ensure that it encompasses all those allied industries that ensure good veterinary public health and food hygiene associated with, for instance, carcass collection, but then also in their processing, they're producing so many important byproducts from from animals, from soap through to important biopharmaceutical products. So that aspect of lobbying is being very important. But in terms of the question of informing, in fact, just over the last few days, we've been examining some of the data in terms of website traffic. And our question and answer pages on COVID-19 have been the most heavily visited pieces of information that the OEE has ever put out. 3 million hits over the last month in terms of the Q&A site. And so it really just illustrates that people are hungry for information. For the OEE, we consider our primary audience is the veterinary authorities, the government veterinary authorities, who are our members. So the sorts of information that our Q&A contains are all those issues that we mentioned previously, the bringing veterinary laboratories into diagnostic testing, the challenges around the testing and surveillance and case definitions, given that we know there is some risk, but we don't want to overemphasize it. And then in terms of ensuring safe trade. So we feel very strongly that the informing role from the veterinary profession is a trusted profession. People, the public turn to it for advice, and so that's a privileged position. We take that very seriously.
That communication, I think, is so important, Matthew. And I think, Daniela, I know from very early on, we've been running webinars together with literally thousands of vets and nurses every Sunday at noon, listening in to the words of wisdom of Daniela, which have been, I know, very much appreciated. And, that Daniela and the team at BVA have been putting that time into communication has been very gratefully received, obviously, by myself. But, we've seen a lot of comments that at these times, comms in every industry has to go up because people want to have the answers. So, thanks for the great work you've been doing, Daniela, on that. If I can just put that across at this point.
Thank you, Anthony. Could I just come back on something that Grant's just said, and it may actually link into the next question. It was interesting to hear Grant say that he thinks that the veterinary profession in New Zealand will be quite resilient and will fare well out of this. And I think this links back to the differences between government responses, perhaps, because certainly in the United Kingdom, we are facing a serious situation where veterinary businesses may face going out of business because they're having to work for prolonged periods in a socially distant manner, which simply means that throughput is lower, turnover is lower, and making ends meet becomes harder. So I think that's an interesting sort of thought process for me, where here in the UK, we really are worrying about the viability of veterinary businesses, and to hear that New Zealand, with a different approach, there's a feeling that actually veterinary businesses will be okay in the long term. I guess now that the question's up, in terms of longer term challenges, certainly for the UK, our concern will be, if veterinary businesses do go under in certain locations in the UK, particularly if it's a remote or rural location, you may end up with swathes of the country without veterinary cover because the one practice that was serving that area isn't there. And certainly when you're looking at a global financial crisis, you're looking at less disposable income for, pet owners and farmers. And certainly we know from the 2008 financial crisis that there was a significant peak in the UK for low-cost charity veterinary services. And so that is another risk. We also know that there are already farmers that are carrying out certain procedures themselves now rather than pulling vet in, and that may have a longer-term welfare impact. And when you're looking at finances, we as a profession may never be able to get that work back. So I think perhaps the answer to this question is it will be slightly different in different countries, because I get the impression from what Grant says that perhaps the outlooks for both of us are slightly different at this stage.
I think almost to come through it well, as New Zealand, seem to have done at the moment, allows, and the East as well, is that there's perhaps an argument that the power is moving over to the East. I think it's something that we've recognised for a long time, but having come out of the crisis better, it will be easier for them to recover in a way that maybe the West will struggle for a lot longer with. So, no, it's an interesting point. Professor Scott, do you want to make a point there?
No, I think I just reinforce what both was said. Every country is a little different in their response. Canada, I think we're kind of in the middle. interestingly where we are with the economics and the impact on the industry. But I think the approach that we've taken is I think, similar to the UK in terms of the education, that regular webinar type approach. And I think that comes back to what was said earlier about the response. Canada, one of the issues we have is, exact opposite of New Zealand. We have 9,000 kilometers of border with a country that, has a bit of a schizophrenic response to this virus. So what will work for us is going to be quite different than what will work for you. Yeah. And what's going to work for a companion animal practice in Canada is different than a food animal practice and everywhere else. So I think we have to realize that there's not going to be a one-size-fits-all approach in managing this in the vet side or managing this globally in the human disease.
No, it's another really interesting point as well, Scott. I think Dr. Scott wants to say something as well. Go ahead.
Yeah, thank you so much. I wanted to add in maybe two elements related to how the veterinary profession needs to contribute going forward. The first is on food systems transformation. And I think that, the challenges that we're seeing related to food security and nutrition security is really pushing us to think about what needs to happen in the long term, sort of as we get through COVID and looking forward. And I think that the veterinary profession really has an opportunity here to first advocate for the need for maintaining healthy and functional ecological systems, because these are really what we rely on for healthy food to feed ourselves. I think also that we want to look at how to better promote safe, sustainable, good farming practices, promoting responsible use of antimicrobials, ensuring abattoirs, meat and aquaculture processing, and some of the food safety and animal welfare issues are all in place going forward. And I think that particularly because of COVID-19, a lot more attention has been brought on to informal food markets, and some of the issues related to sustainable wildlife consumption and bushmeat and wildlife farming. I mean, to me, these are all areas where really improving food safety and management as we know it as a veterinary community, I think this is where we can have a really great impact. The other element that I want to raise that I think has to do with ecological approaches, and I think that we keep talking about what are the drivers of emergence, and we recognize that, sort of the three main drivers, changes in agricultural production and systems is one of the biggies. And I think that we're in a place where we can start to look at how to promote better sustainable, climate smart aquaculture and livestock production, and advocate for educating farmers on the benefits of agroecological approaches. And so really it's about getting to a place where we're sustainable, where we can still produce more food, be more efficient, but take care of the environment that we know we so much rely on, not only to protect our day-to-day life, to have healthy air and water, but also to prevent us from having exposure to these types of diseases. If you'll allow me one more second, I want to just touch on One Health because it's come up a few times. And I think that, we talk about One Health to a large extent involving human, animal, and ecosystem. But I think that, the honest truth is, if we really evaluate One Health so far, we're probably at about a 2/3 health right now at a global level in many places. And where we have the opportunity now is to look further upstream on the epidemiological curve. So it's not just picking up viruses when they first spill over from wildlife into people or from wildlife to livestock to people, but it's going upstream and trying to get at the drivers again. And this involves engaging the forestry and natural resource management sectors and helping them to understand why it's important for us to evaluate these systems together. And obviously, we know that natural resource management, land use planning, biodiversity conservation, these are all big terms that we haven't quite brought into our One Health approach.
These are such good, well-made statements. We obviously started off the conference all about climate change. And I think if there's one silver lining to the cloud of coronavirus, it is that, the world in London, in Liverpool, the world is breathing better because, of course, cars haven't been driving, et cetera, et cetera. So it is so important that we hopefully hang on to that environmental advantage, because without our world, we are homeless, aren't we, all of us? So a really great point. I'm just conscious that we've got 5 minutes of just allowing people to come up with questions. So Daniela, if you've got a sort of 30-second to 1 minute
Yep.
statement, I'll give you that, and then maybe just ask a few questions. So over to Daniela.
Yep, I think as well as the One Health opportunities that have come from COVID, I think there's workforce opportunities. Certainly in the UK with our retention issue, I see COVID as a positive learning opportunity. You know, how can we work more efficiently? Can we use remote working? And for 30 years, we've been saying flexible working isn't possible. We've now shown it is. So I think there's benefits to the workforce as well.
We did a session during the week on digital summit, and part of that was somebody speaking about telemedicine. So absolutely agree with what you're saying there, Daniela. And obviously those of you who are listening who bought into the whole conference can obviously go to any of those sessions. Just a question from Sylvia. I mean, it's a statement more than anything, which people may want to comment on or not. My question is about the avoidable post-harvest losses that farmers are experiencing. Why are dairy farmers in Canada or USA pouring milk, and yet I expected developed countries to have capacity to process all the milk into powder? Here in Uganda, dairy farmers and poultry farmers are affected, and the government is telling them to process into powder. Unfortunately, most farms lack capacity to process. I expected farmers from developed countries to be better able to help us here. So maybe just a very quick one, Scott, because it's probably 20 seconds. Any thoughts on that one, Scott?
Yeah,
The responsibilities of the North and the West.
Sure. I mean, look, I think this virus is impacting all countries at farm level, along value chains, particularly with small and medium enterprises that are responsible for helping have added value food products. And that's, it doesn't matter where food is being produced, it's the same challenge. And so I think that this is a global challenge. And again, this links to that food systems transformation approach that I think we need to be taking.
Great. A couple of more questions, because I do want to get through as many as I can. I think to Michael, somebody's saying here, it seems to be an overreaction of the immune system that causes the severe disease. Is there a danger that vaccine will be counterproductive? That's one for Michael.
Yeah, I think that overreaction is a feature of many severe pneumonias, and that is obviously frequently part of that cascade that results in very poor outcomes for some patients. But no, I think it's very different from the immune response, unless this disease behaves differently from others, and it is different in some respects. The hope would be that inducing immunity will be highly protective against infection, and that shouldn't exacerbate disease. But there have been a few missteps in the past with some vaccines creating an immune response which is harmful. And I think you look at dengue fever and the experience there is, I think, an example of a potential problem. So we still don't know everything about this disease, but I think the working assumption is that immunity will be protective.
And the vaccines that are being created, a question from Marinus, are they live or dead vaccines? Or are they genetically modified ones?
Well, I think
Michael again.
Yes, there's a whole range of approaches here. And I don't think in advance you'd want to give up on any potential option, but obviously there's a whole sequence of safety steps that will whittle things down, I think, quite quickly. The area that I think is most interesting is people lining up in large numbers for challenge studies, which is obviously very heroic.
Yes, Well, one of my friends was down in London, was doing that this week. So great to see so many nations coming to the webinar today. Sati from Nigeria has said, can people who have recovered from COVID-19 be reinfected and come down with the disease? That's one for Michael as well. Sorry, you're the medic in the room, so we're making full use of you.
Well, I think it's too early to say, but certainly this has been confused a great deal by retesting people who appear to have recovered and detecting traces of RNA weeks or months later. And I think this particularly happened in South Korea, where they do a huge amount of testing and also retesting. And I think they put out an idea that maybe there was a range of scenarios such as resurgence of the disease in an individual patient, or return of the disease, or reinfection. And I think it clouded things. They've since done a big back step on that and suggested actually that was just a function of the test sensitivity. I don't know if anyone else followed that.
I think sometimes as well the virus has gone, but it is that cytokine cascade crisis that actually can be the thing that causes real danger to the people as well, isn't it?
And the fecal shedding that's been prolonged has been identified, has been really largely dismissed as probably not clinically relevant. It seems to be some persistent shedding of dead virus. So even though you can find feces from people from a while by PCR, find the vaccines by PCR, it's not thought to be a big deal.
Yeah, great. Thanks, Scott. I think just one more question that I'm conscious. Sorry that not everybody's questions have been answered, but hopefully this has been helpful for you. Leslie's saying, what other factors might be involved in the low human case numbers in many Southeast Asian countries like Cambodia? And is there any theory on why children have had disproportionately low number of cases of severe disease? Again, Michael, sorry, last time, I promise.
Yeah, no, that's right. Look, we should have said the other countries that are also succeeding in containment are Vietnam, probably Thailand, apparently Mongolia. I mean, not always sure the quality of data. And these are low and middle income countries, and they are just doing basic things very well. And I think that gives me huge hope for low income countries generally. And they are using just standard methods, particularly masking and avoiding different approaches for physical distancing, but not a lockdown. And also where they can doing testing, but they don't always have the resources. So I think this disease can be managed with quite low-tech approaches. But the core thing is that governments have to be very organized and mobilize people in a systematic way early. That seems to be the essential element. So early and vigorous and using masking seem to be common elements in those countries. Yes. In terms of disease in children, I think this is still the other big mystery, is that children get infected possibly as much as adults. They have quite a high viral load, but they appear not to be very infectious. There are very few outbreaks linked to school attendance. So I don't know if anyone else has a theory on this. This is the other big mystery, along with immunity and duration.
Anybody want to leave a last comment before we pass over to Pat? I think, Michael, you've finished it splendidly there. I know Pat wants to thank everyone for taking part and also begin the slightly sad thing of having to draw the conference to an end. So, Pat, it's over to you.
Great. Thanks so much, Anthony. And so my name is Pat Turner, and I'm president of the World Veterinary Association. And on behalf of the WVA, I would like to thank our panelists and moderator today for this important discussion session on COVID-19. As has been discussed, and as you, the participants, are aware, these past 5 to 6 months have been a time of global turmoil because of the emergence and spread of SARS-CoV-2 virus, an agent that has exemplified the need for further attention to the interface between human, animal, and ecosystem health. We've been significantly challenged as a profession to respond to this pandemic, and we've seen veterinary professionals come together around the world and step up to respond. And I want to emphasize, again, the critical role that vets have played throughout this period, through communications to our clients and to the general public, in assisting governments to plan responses and messaging for human and animal health at local, national, regional, and international levels, in developing and running SARS-CoV-2 diagnostic tests, by initiating research and overseeing conduct of studies related to SARS-CoV-2 virus, and new therapeutics that are under development to prevent and treat the infection in humans, as well as through the courage, integrity, and selflessness that have been shown by many of our colleagues in showing up for work every day throughout this time to ensure that animals have remained cared for and managed across different sectors while the public has largely been sheltering in place. Throughout this period, we've seen new ways of working and practicing veterinary medicine emerge, in particular with telemedicine markedly expanding as a routine way of working in many countries and regions. And this is going to continue as we learn to live and work with this new reality. While we know that many regions of the world are starting to emerge from the worst of the COVID-19 pandemic, our work is certainly not over. And we have all the challenges of finding new ways of working within our practices, of dealing with the backlog of medicine and surgery cases for our waiting patients and clients, of dealing with depopulations, shutdowns, and backlogs within the food animal sector, on-farm and at processing plants, of surveilling companion animal populations to better understand potential virus exposures and species susceptibility, as well as many other considerations as we prepare for future viral surges or pandemics related to this or other agents. As we emerge from this first wave of COVID-19, I'd like to remind everyone that it's important that we continue to focus on what we can control to protect our health and resiliency. This has been a devastating past few months for veterinary professionals and their families, with significant mental and physical health issues and economic consequences. We need to continue to practice caring and compassion to ourselves and others as we move forward into a recovery phase. There's much that's still unknown about this virus, but as we've heard today, and as we've seen, there have been many successes, and we've learned a lot about how we can manage our interactions to protect ourselves and others. We must keep ourselves up to date as practitioners as more information is gained to avoid panic and poor decision-making amongst the general population as it relates to others. And I would encourage each of you to keep informed through messaging provided by your national and regional veterinary associations, as well as through international agencies such as the OIE, the FAO, and the WHO. This is also a time in which we should closely evaluate the different sectors in which we work with animals around the world and evaluate where challenges have occurred over these past few months, and this has been mentioned this afternoon. Significant issues have been seen in many countries related to animal welfare for a range of species, companion animals and food animals, but also challenges with managing caring for animals in zoos, shelters, and sanctuaries, as food sources and transportation have dried up and volunteers have been unable to come to work. We've seen continuing problems with access to veterinary medicines and therapeutics, issues with sustainability of current food animal production practices, and ongoing or new barriers to trade and movement of animal products, resulting in food security issues in some parts of the world. This has resulted in significant interest in One Health-related issues, nationally and internationally, and an area that veterinarians with our training in comparative medicine and public health are ideally situated to respond to. We have a window of opportunity to capitalize on this attention to work together with partners in animal, human, and environmental health sectors to lobby for sufficient resources and funding to be made available globally by public and private sectors to improve global animal health and welfare, ecosystem health, and public health, as well as improving veterinary education and competency so that all countries have sufficient capacity in veterinary services to respond to current and future infectious disease challenges that may impact animal and human populations. These are all priority issues for the World Veterinary Association and are ones that we will continue to work on with our partners over the coming months. As this Congress draws to a close, I'd like to take a moment once again to thank all those who've been involved in planning and organization to make this year's World Veterinary Association Virtual Congress a success. The New Zealand Veterinary Association, the World Veterinary Association Congress Organizing Committee, Dr. Zeev Noga from the WVA Secretariat, the Webinar Vet team, and all of our contributing speakers and experts. I'd also like to thank the WVA's Congress partners, the OIE, the WHO, the FAO, the World Medical Association, the International Veterinary Student Association, World Horse Welfare, and the Donkey Sanctuary for working with the WVA and the New Zealand Veterinary Association to co-organize and participate in WVA-specific events during the Congress. And finally, I'd like to thank all the many sponsors for this Congress, without whose support this event would not have been possible. And with that, I'll hand the floor over to Dr. Grant McCullough, President of the New Zealand Veterinary Association, to deliver a message.
Tēnā koutou. Thanks, Pat. And I certainly want to thank the panelists for their time today. I found that a really interesting and rewarding session, and another example of, as Matt spoke about, of the collaboration in the scientific community when faced with this sort of challenge, and that's been really heartening to see. It's certainly been a pleasure for New Zealand Vet Association, in association with Webinar Vet and the World Veterinary Association, to bring you not only today's session, but the whole festival of online learning over the last 3 weeks. If you've been inspired by this, please encourage colleagues to join up. There is a huge library there of recorded sessions, and they're going to be available online for the next 6 months, and it covers all aspects of veterinary profession. I want to conclude today by saying my sincere thanks to everyone who's made this event possible, and to declare the 36th World Veterinary Association Congress officially closed. It's my honour now to pass the flag, figuratively speaking obviously, to the Taiwan Veterinary Association, and it seems fitting given how Taiwan's responded under the current pandemic. And so they will be doing, I'm sure, a great job in hosting the 37th World Veterinary Association Congress in 2021. Haere mai, and farewell from New Zealand.
It's our pleasure to host the 37th World Veterinary Association Congress that will take place from April 23rd to 25th in Taipei, Taiwan. A beacon of democracy in East Asia, Taiwan now has an industrious population of 23 million. Surrounded by ocean, Taiwan enjoys azure seas, magnificent coral reefs, and a very rich marine ecology. One can easily participate in sea activities and explore the beauty of the ocean around the island and all the offshore islands belonging to Taiwan. There are various ways to discover the beauty of Taiwan. In Taiwan, you can crisscross mountains on historical hiking trails or cycle down a lone highway with the blue Pacific on one side and green volcanic arcs on the other. And if you simply want classic landscapes to enjoy, you'll find them around every corner. Food is always a priority in Taiwan. People used to greet each other by asking, "Have you eaten yet?" That's why you will always find a restaurant with every step. As many different cultures have made a home in this country, a vast range of local and foreign specialties have become a part of Taiwan's culinary landscape. Such diversity makes Taiwan a gourmet's heaven. And one should not forget that Taiwan's tropical climate also brings the country a wide variety of especially delicious fruits. WVA and TVMA are working hard to carry out a top-level scientific program with speakers from all over the world. We are expecting about 1,500 delegates from across the globe. 15 streams focusing on these 8 fields will be delivered. TVMA is also planning exciting social programs that will give you a taste of Taiwan's culture and cuisine. For more information, please visit our official website. If you would like to receive the latest news about the Congress, please don't hesitate to subscribe to our newsletter. We are very much looking forward to welcoming you all to the 37th World Veterinary Association Congress and to Taipei, Taiwan.
Great. So just to conclude, on behalf of the WVA, we are looking forward to seeing everyone at the WVA Congress in Taiwan in 2021. Thank you again for your participation in the 2020 Congress, and I wish you all the best in the coming months.